Do you ever feel confused about whether your body matches the gender you were told you are? That feeling can be a sign of a condition called disorders of sexual development, DSD. DSD means the chromosomes, hormones, or reproductive organs don't line up in the usual way. It's not a disease you catch, but a difference you are born with. Think of it like a puzzle where some pieces don't fit the usual picture. You might need a different guide to understand it. What could cause the puzzle pieces to be different? Most DSD cases start from genetic changes, a tiny switch in the DNA that tells the body how to make sex hormones or build genital organs. Sometimes the body makes too much or too little hormone, or the receptors that read the hormone signals are off track. Rarely, exposure to certain chemicals in the womb, like strong endocrine disruptors, can also play a role. In short, the root causes are usually genetic or hormonal, not something you did. How might you notice a DSD? Imagine a newborn with genitalia that look a bit different from the typical boy or girl pattern. For example, a small penis with hypospadias or labia that are larger than usual. Later on, a child might experience delayed or rapid puberty, unexpected breast growth, or trouble with fertility. These signs are like clues that the body's gender instructions are written differently. Not every person with DSD has obvious signs. Many are discovered only after a medical checkup. If a doctor thinks a child might have DSD, what steps will they take? First, they will do a physical exam and ask about family history. Then they usually order blood tests to check hormone levels and a chromosome test, karyotype. Imaging, such as an ultrasound, can look at internal organs. Genetic sequencing can pinpoint specific gene changes. Treatment is personalized. Hormone therapy can help develop secondary sexual characteristics. Surgery may be offered to modify genital appearance, but only after careful counseling, and lifelong psychological support is essential. The goal is to help the person feel comfortable in their own body. Can DSD be prevented? Because most DSDs stem from genetic variants present at conception, there is little you can do to stop them from happening. However, good prenatal care, like avoiding strong endocrine disrupting chemicals, certain plastics, pesticides, and managing maternal health, may lower the risk of hormone-related disruptions. Early awareness and a supportive environment can also prevent unnecessary stress and stigma for the child. Recent advances include rapid whole genome sequencing, which can identify the exact gene change within days, allowing faster, more accurate diagnosis. Researchers are also developing gene editing models, CRISPR, to study how specific mutations affect development, which may lead to targeted therapies someday. On the surgical side, minimally invasive techniques and better timing guidelines aim to reduce scarring and preserve function. Finally, international patient registry projects are improving our understanding of long-term outcomes and mental health needs, ensuring care stays person-centered.